Hi, I'm Mike Carberry. I'm a chiropractor.
I'm Coleen Carberry. I'm a physical therapist.
And we are the owners and founders of Advanced Medical Integration. We're going to talk about a program where we're helping people with sales and selling their services and their products to the public.
Yeah.
We do have a lot of good information, a lot of good data for our clients to help them do that.
And for our public.
And for the public, yeah.
Yeah.
So, like, one of the things we see is a lot of practices, especially over the last 5 years, revenue is being cut. I mean, Insurance companies are getting brutal. It seems like in the past few years, especially since the Affordable Care Act, which has been 10 years now, more than 10 years, the income to doctors has been cut. And not just in chiropractic, but in a lot of fields.
Yeah.
But especially in chiropractic. I remember if somebody was doing 400 visits a week back in the 90s, they were killing it.
Yeah.
But we've met people doing 400 visits a week, and they're barely paying their bills.
Yeah.
You know, averaging like $40 a visit, and they're not being paid for what they do.
Yeah. You know, it's a fee-for-service environment.
Yeah.
So when you say back in the 90s, right, you did a service, you got paid for it, and the fee schedule was decent.
Not as good as you did in the 80s. But yeah.
This is true. But you still got paid for it, even in the 2000s. But the thing is, with the fee-for-service, it's like you have to figure out everything you do, and you have to match it to a code, and then that code has to be medically necessary, and you have to follow all the guidelines of that code, and they still pay you a little bit. And it's like a fee-for-service program that is just paying less and less and less.
Right.
That's what's happening, yeah.
Exactly.
Yeah.
So how do you step out of that world?
Yeah.
And I remember years ago people saying, I'm so sick of insurance, I'm not going to do it, I'm going to be all cash. I'm like, well, why would you do that? But there's a lot more people doing that now, including us.
Yeah.
The freedom you get from being able to charge somebody. So let's just talk about insurance for a minute. I believe health insurance, was created to create an unlevel playing field.
All right.
Let me explain what that means. You go to a chiropractor, they don't cut your body open, they don't put toxic chemicals in your body, they do stuff to your body, and you feel better. And the studies show that it absolutely proves that you get.
And the body will heal
improves.
itself.
Yeah. Or you go take a drug that has side effects of possibly 1 out of 3 people are addicted by the time they take the third pill. Or it causes you to bleed to death in your intestines. Or it shuts your liver down, or it shuts your kidneys down. And it costs a lot of money. Like, what were they charging from some of those OxyContin pills? I mean, it was ridiculous.
I don't know, but a lot, yeah.
So how do you get that so that people would choose that over the first option? Well, you got to unlevel the playing field. And how do you do that? You cover one thing better than the other. That's my personal opinion, and nobody's going to shake me of that. So when you finally decide, I'm not going to play that game anymore, if somebody wants to get well with our services, they have to pay for it. If they want to try to get it from insurance, that's up to them.
Yeah.
That's very liberating.
Yeah.
Very liberating, because you're no longer working for an insurance company. You're
Yeah.
working for the patient, which is the original agreement.
Yes. Liberating, but does take a little
You got to have a system.
retraining. Well,
gotta-
the
you
system.
gotta-
Yeah, there's systems. Well, the thing is that the system has trained doctors to be attached to this third-party payer system.
Right.
And so it's just a mindset shift, isn't it?
That's right.
Yeah.
Every system starts with mindset.
Yeah.
Like, what is your mindset? Sales is no exception to the rule. Sales is all about how you think. You watch your thoughts because they become your words. You watch your words because they become your actions. You watch your actions because it becomes your character.
Yeah.
You watch your character because it becomes your destiny.
Yeah.
I think that was
Yeah.
Lutz Sal said that, if there was actually such a guy.
Okay.
But that's an ancient Chinese statement, and it's really your mindset is first. Well, your thoughts are first. So
Yeah.
to make any system work right, you have to know the right mindset.
And the right mindset. You know, at AMI, because our mission and our vision is so strong, we definitely have clients. We have systems and we have clients, but we have an offer here today. We have something free to give to the field, because we feel that strongly that chiropractors and doctors who treat people without drugs and surgery need to make it.
Yeah, I don't want my profession to go away.
Yeah.
I recently had an opportunity to speak to a lot of students at different schools because I had to take my boards over, and I was in board reviews.
Yeah.
I didn't have to take them over. I had to take them because there wasn't Part 4. I was required to take Part 4 to get a license in a certain state.
Yes.
And I got a chance to speak to these students, and a lot of them are saying, they're telling us that 1 out of 3 of us are going to be out of the profession within 3 years.
That's crazy.
It is
totally
crazy.
crazy. Yeah. But I want to talk back to this, not just to the students that are coming out. This isn't something just for the chiropractic field. There's medical doctors that don't want to prescribe as much. They don't know any system different.
Right.
So this this offer that we're giving to people for free, like this is like, we want to help people. This could be for a physical therapist. It can be for a chiropractor. It can be a nurse practitioner who owns their own practice, right? What we're doing here is we're basically saying, let us help you. And I know that you particularly wrote this series. It's a series on sales and selling, right? So tell me about the series. What is it that you've created?
You have to create something that, well, here's the thing I see that scares people.
Okay.
It means you have to confront something. Now, confront doesn't mean fighting. It means actually you got to face something. You got to be willing to experience something or have somebody else experience something.
All right.
And that thing is control.
Got it.
So I know that over the years when I talk to people about control, a lot of people are like, oh, control's bad. Well, control's only bad when you don't have it. If you're in a car that was under control, that's good. If you're in a car and the driver has a heart attack and there's nobody controlling the car, that's the worst scenario you could be in.
That is a problem.
Yeah. So it means control. And control means telling a patient they need to do something. Well, I don't like to tell my patients what to do. Well, then what are you a doctor for? Doctor means teacher. So the idea is you have to tell a patient, look, your plan got you into my office. My plan is going to get you out of the office, which means you have to have a plan. And that's one thing that a lot of doctors, not most, but a lot, say, oh, I don't like to give my patients care plans. So you're leaving it up to them to decide?
And we understand, too, is that medical doctors who totally can benefit from this series that you wrote, right? They don't even know how to do a care plan. Like I'm sure they'd be open. Nurse practitioners own their own practices, right? Physical therapists, right? Like this is open to any field.
Right.
Yeah.
So when you're doing something like physical medicine, you're stimulating the body to respond to repeated stimulus. That means a frequency. Yeah. And frequency turns out to be the most important aspect of any care plan. So it's how frequently, like, well, I do this technique. Okay, great. I do that technique. Oh, that's wonderful. How frequently do you do it?
Yeah.
So what we found is the basic care plan is the same as like somebody going to a gym, and that's 3 times a week. And a lot of people go, well, I don't like to do that. That's overutilization. No, it's overutilization if you follow the insurance definition of overutilization.
Yeah. Well, and again, some practitioners don't recommend any visits. They recommend one and come back if it bothers you again.
And why would you trust a person who got themselves into that mess to figure out how to get themselves out of the mess? Yeah. They're coming to you for help.
Totally.
So you got to give them guidance. So basically the idea is the frequency is, how often should you go to the gym? If you're going to try to stimulate your body to get stronger and healthier, how often do you have to go? And most people say, well, at least 3 or 4 or 5 times a week. And sure, so how many times do you think we're going to need to see you? Oh, at least 3 or 4 or 5 times a week. Well, yeah, we think 3. So we get people to come in 3 times a week. And that takes a step of confront. Yeah. And controlling the patient.
Do you help in your videos? Is this something that you help to teach people?
That's something we discuss. How to help
that's
people.
Great.
How do people get a care plan established that will help this patient get better? And we're not basing it on pain. Okay. Because that's where overutilization comes in. If you assume that, there's a lot of assumption in healthcare. Well, if the doctor's job is to get him out of pain, who said the doctor's job is to get him out of pain? No. The doctor's job is to get their body to fix itself because it can heal. And apparently it's having trouble doing that. We don't want people to have pain, but if you break a bone, whether you like it or not, you're going through some pain to heal that body up. Yeah. And that's just the name of the game. So
I get that.
By helping it to heal quickly and less painful, you're going to get a better outcome. So the idea is confronting the patient of, here's what's wrong with your body right now. Here's what we need to do to get it to be better. We're going to base it on your ability to function, which is literally the contract between the insurance company and the patient. I just sat through a conference in the at Florida Chiropractic Association, and there was an attorney saying, if you're treating a patient, you get them out of pain, you need to discharge them, unless you're treating and measuring their functional ability.
Which, of course, plug for AMI. AMI has all the systems to be able to do that, to be able to actually document functional growth or functional improvement. But
we've been doing that for 25 years.
We have been.
A quarter of a century.
Yes. But we're here to talk about helping not only the chiropractic public, but medical doctors, nurse practitioners, whoever needs help in getting away from a fee-for-service system, but actually being able to tell a patient what they need and getting the patient to exchange money for it.
So if you know your product, whether it's a care plan or whatever it is you're doing, nutrition, something that needs to be repeated to get the body to heal, Then you have to understand the value, and you have to convey that value to the patient.
So they what? Give you money.
Yes, because price is only an issue. Brandon Dawson said this.
Yeah.
Price is only an issue in the absence of value.
Yeah.
One of the most brilliant statements I've ever heard. So if you build the value, if people understand what you're selling,
Yeah.
they're going to be willing to pay for it. And when you cut through all the BS in healthcare and you actually understand what it is that this doctor is selling, they're actually selling something that's very, very valuable.
Yeah.
More valuable than a person's car.
Yeah.
And when you look at people's cars, people spend on the very low end usually about $10,000 for a car, but on the high end, $100,000 for a car. And somewhere in there is a price that they'd be willing to spend on fixing their own body. So we're not saying, oh, go out and charge people $60,000, although there are people that would pay that. What we do is we figure out, well, what would we do to help this person and get exchange for it?
Love it.
And if you're avoiding a surgery, well, let's not forget the number one reason for personal bankruptcy in the United States is unpaid medical bills. And 3/4 of those people had insurance. So the idea that insurance is going to protect you from bankruptcy, that's a myth.
Yeah.
Nothing
Totally.
could be farther from the truth.
Yeah.
So if you can show somebody the value of what you're doing and explain to them in a concise way without overwhelming them, this is what we do, this is how your body works, and this is why it's going to work.
And that's in these videos. You help people out with these videos.
Exactly. How to explain
Yeah.
these things, how to collect data from the patient. It starts with the patient. Collect data from them, and then show them what you're going to do that's going to help them. And the patient realizes, okay, this is the place I've been looking for. And the amount they were willing to spend just doubled or tripled.
That's phenomenal. And I understand the videos are about 38 minutes long. You
Yeah,
can
they're
get through the videos. You can really walk away with some actionable steps.
Yeah, very simple
Yeah.
concepts. So that's why we created them, so people could flourish and grow.
That's great. That's great. Yeah. Anybody out there, if you are looking to increase your selling, to increase your ability to convert a patient to care and have them exchange money for it, you wrote all these videos. They're phenomenal. Yeah.
Okay. All right.
Thanks
For listening.